Okay, so there is the ventricular pressure which is greater than the atrial pressure. Okay, uh, atrial pressure uh, continues to rise because of venous return. See, in isovolumetric relaxation, uh, there is uh, immediately after the closure of the semilunar valves, the ventricles are rapidly relaxed and ventricular pressure decreases rapidly. But the atrioventricular valves remain closed as initially the ventricular pressure is still greater than the atrial pressure. This is isovolumetric relaxation. Then the atrial pressure continues to rise. Okay, the atrial pressure is continues to rise. Okay, because of venous return, because uh, of the venous return, and here also the blood coming in from the pulmonary veins. Okay, and here from the superior and inferior vena cava. So the venous return increases and the atrial pressure also increase with the V wave of the GVP waveform peaking during this phase, and in the GVP after the X descent the V waveform is occur. Okay, okay, it's seen here as the ventricles continues to relax, and the ventricles continues to relax, the ventricular pressure falls below that of the atrial pressure and the AV valves open, and at the end of this phase the ventricular pressure decreases less than the atrial pressure. Okay, and so the atrioventricular valves get open. Okay, so this was the isovolumetric relaxation. Now the ventricular filling. Last phase is ventricular filling. Okay, here when the atrioventricular valves open, okay, when the this is the heart, and when the atrioventricular valves opens, the atrial pressure falls. The atrial pressure will fall. Okay, the Y descent of the GVP waveform, and this will form the decrease in the atrial pressure. It will cause the Y descent, as we have seen earlier. This is the X descent, the V waveform, and after that the Y descent. Okay, it will seen here in the ventricular filling. Okay, and the ventricles refill initially rapidly. The ventricles refill initially rapidly. Okay, the rapid filling phase, and then more slowly as the ventricles expand. Okay, first they fill rapidly and then more slowly as the ventricles expand. Okay, becomes less compliant and ventricular pressure rise. Okay, and the ventricular pressure will increase. Okay, the reduced filling phase, and this is the reduced filling phase. First it was the rapid filling phase, and then it's the reduced filling phase. Okay, rapid flow of the blood from the atria into the ventricle causes the third heart sound. Okay, and this is the rapid filling phase from the atria to the ventricle produce the third heart sound. Okay, so here the third heart sound will heard during the Y descent and the ventricular filling phase, which is normal in children, but in adults is associated with decrease such as ventricular dilation, associated with disease such as ventricular dilation. Okay, in children it is normal, but in adults it's only heard in the ventricular dilation. Okay, so this is only in children. Then diastole is usually twice the length of systole at rest. The diastole is usually twice the length of systole at rest, but decreases with increased heart rate. Okay, the diastole is usually twice the length of systole. Okay, this is the then twice the length. Okay, but decrease with increased heart rate. It is decreased with increased heart rate during systole. Contraction of the ventricles compresses the coronary arteries and suppresses blood flow. Okay, contraction of the ventricles compresses the coronary artery and suppresses the blood flow. This is particularly evident in the left ventricle. Okay, where during systole the ventricular pressure is same as or greater than that in the arteries, and as a result more than 85% of left ventricular perfusion occurs during diastole. This becomes a problem if the heart rate is increased, as the diastolic interval is shorter and can result in ischemia. Okay, thank you.